Thank you, Ashley. Well, hip pain is a common ailment, but advances in hip replacement mean that people don't have to suffer pain needlessly. And here to talk about some treatment options that can improve quality of life is Dr. Philip Minotti, an orthopedic surgeon at the Connecticut Orthopaedic Institute. Doctor, thank you for joining us today.
Thank you very much for having me.
And let's start with the basics. What are some of the more common hip conditions that people are dealing with?
Probably the most common condition that I see, or the most common condition that requires surgery, is osteoarthritis. That would be wear and tear arthritis of the hip joint. That's probably the single most common, but other common disorders are fractures in older folks that may require surgery, and then some sort of soft tissue injuries. But the most common issue that I deal with is osteoarthritis.
And for people suffering with this pain, and it's starting to bother them, how do you know when you get to that point when it's time to see a specialist?
Well, that's a great question. Everybody's threshold is different. You know, some people will wait until they're halfway in a wheelchair, and some people are in the office a lot sooner. I think it's important to recognize that quality of life determines treatment options. And, you know, your primary care doctor can help you decide when you are ready to have surgery, but certainly quality of life is what drives people into the office to seek treatment. You know, when your quality of life is suffering and you're having trouble doing simple things, getting in and out of a car or putting on your shoes and socks, people tend to seek out professional help.
And it seems like things have really advanced over the years. Tell us about some of these advancements in surgeries that some people can even be walking home in the same day.
That's right. There are a lot of outpatient hip and knee replacements being done, and I think that's a function of about three factors: surgical technique, anesthesia, and advances in anesthesia, and attitudes about joint replacement. And attitudes have changed remarkably about hip and knee replacement. People believe they can do it, and that's really the first step in going home on the same day, is believing that you can do it. And again, there are some surgical techniques that have made it more suitable. For instance, I do something called the anterior approach to the hip, which allows people to get home quickly and get back to their normal activities a lot more quickly than older techniques.
And doctor, you have an upcoming webinar. Can you tell us about that?
I do. I'm doing a webinar on June 29th at 7 p.m. where we'll be spending a lot more time talking about arthritis and some of the treatments, as well as some of the non-operative treatments of hip and knee arthritis.
Excellent, doctor. And I know you said there are a lot of people that are dealing with this. Talk to us about just how common this is and about how older folks, when they start to have some of these issues.
Well, it's extremely common. I believe in 2020 there were nearly 500,000 hip replacements done in this country and about 1 million knee replacements. So my message to everybody out there is you're not alone when you have hip and knee osteoarthritis. There are a lot of people that are dealing with it. And it's not just the elderly. I do hip replacements in people in their 20s and 30s. Now, that's not because of wear and tear or age-related changes, but it is a procedure and a surgery that is suitable for a lot of people when their quality of life is impaired.
Orthopedic surgeon Dr. Philip Minotti, thank you so much for being with us.
You're welcome. Thank you for having me.